us to tea time.
Yay!
Our topic, the effects of racism on labor and delivery. So first, can you give us your credentials? Let's start there.
Okay, so I am a certified nurse midwife, which just means that I was a nurse first, and then I went back to school to get my master's degree in nursing, specifically in midwifery and also women's health. So I am also a women's health nurse practitioner. I'm certified in that as well.
Okay.
Wow.
With all the degrees.
Right, all the letters behind you.
Mhm. Okay.
I love
Gonna
it.
be like Tasha Brown, LMNOP, TUV.
It does get like that.
Listen, all the letters.
All of them.
I love it.
So then, can you explain what a midwife is? Like, what does that mean?
Yeah, so a midwife is originally, as most people think of midwives when you say it, are women who deliver babies at home. But in this day and age, we also do GYN care, so gynecologic care. You can come in for your like annual checkups. We do birth control, STD
Wait, y'all do
testing.
annual checkups?
I was
Yes, we do
listen.
annual
You had me hooked there because I'm like, I will switch today.
Switch right now.
Okay, because my person, I'll be like, girl, this not it. Like you are not it. So I will switch right now today.
Yes, you can
We
come
got
in.
options.
Listen,
Yes, you have
what kind of
options.
insurance y'all take? We'll talk later because I'm like, you know,
Let me grab my health card real quick. Are we in network?
I'm sure we are.
because I'm
But
switching
yeah.
today.
Yeah, you can get a full physical, get some
Okay.
labs done, you know. if you need
Wow.
prescriptions, I can write prescriptions, so I do that
Okay.
as well.
You a drug dealer?
Yeah, I'm a dealer. Yes, all the drugs.
All
Okay.
drugs.
So also, you know, if you're pregnant, obviously we do all your prenatal care, do your delivery, and then also see you postpartum care as well. We even see women up through menopause. So like we do it all. And you can work in the hospital setting. Mostly certified nurse midwives work in the hospital because of, you know, state by state laws is different.
Mhm.
Depending where you are, but there are some certified nurse midwives who can work in a home birth setting or birth center. So that just means that they have more leniency. They kind of work on their own, having their own businesses usually, and are able to do more things like water births and kind of more holistic care. But part of our difference between a midwife and a physician is that we do kind of focus on more holistic, like whole person care. It's getting the whole family involved, you know, kind of diving deep into a person's life versus just what is your medical condition.
Okay. So then who are the people, or maybe I should ask it differently. Are there other people that assist in home births that are not called midwives? Because I feel like there's other people out there and I don't know what to call them.
Yes, so there are a ton. So you can have like a labor support person. It's called a doula.
A doula. That's the word
That's what
I'm
it
thinking
Yes,
of. Okay.
yes. So the doula is also a person who helps basically support mom. They're there to cater to mom, get her through that labor. They also provide like some of them are certified in lactation services, so they provide breastfeeding support. They're there for postpartum support. So like if mom needs some extra help after their baby's born, they're the go-to person. They do a lot of home visits. Everything is really personal. They get to know them throughout the entire pregnancy and are there to answer questions, and sometimes even just being a voice for that person who doesn't know what to ask or doesn't, you know what they're going to be getting into with pregnancy and birth. So they provide a lot of services.
Sounds like they don't mind their business. That's what I'm hearing.
Yeah.
That there may be a boundary issue with
Maybe.
doulas.
Yeah,
Okay.
they get real down.
Yeah.
and dirty.
I mean, that's a deep connection. To have a baby is such a deep connection where that person is definitely going to be helpful, because I'm sure they obviously have some understanding of what the woman is going through. But then to bring that family connection together with the midwife, if they're working with the midwife, like I think holistically and working with the family and not just the mom, is such a deep connection.
Absolutely.
To all of that. Shout out to Symphony Zawadi, who was on our show as well, Melanated Mama, who worked with the doula for her last child's birth, and they did a home birth. So Yeah.
That sounds like something she would do.
Yeah,
I
absolutely.
totally get like
Yes.
home birth doula vibes. from
Yeah,
her.
same.
We just have that.
Yeah. Isn't Erica Badu a doula?
She is.
Yeah.
She is. I think she actually is becoming a midwife or has become a
Okay.
midwife.
Oh,
So she
wow.
probably be burning incense and
Listen,
wrapping the
and
mama's
singing?
hair and singing.
That would be such a
But
dope
she probably be
experience.
rapping.
Yes.
Okay, she be rapping.
I would love for Erica Badu to be my doula. Like, so tight. Like, baby, come out just extra tight.
Yeah.
Wow.
That is so funny.
I love it.
So then what made you want to get into nursing?
Oh boy, it was really the experience of being pregnant with my daughter, and she was actually born with a birth defect where she needed to be in the NICU for about 3 months after she was born, and I was young, and I didn't know anything. I had no idea what I was going to be experiencing, what I was going through, and then I get hit with, oh, now your baby's going to have these issues, and it was like, okay. And what else?
Right.
And, there was really no like education. There was no like, oh, here's some support services or resources or, other moms you can talk to. There was none of that. And so like seeing that and going through that, and then also having some really good conversations with some of the nurses who were taking care of her in the NICU. I really, being there every single day, built a bond with them, and they were telling me, all of the things that I should have been told during that time, and, giving me little tips and stuff. And I was like, man, this is okay. Like these people are really helpful, and the nurses seem to be the ones doing all of this. So let me do this. And
Shout
so I
out
was
to
like,
the
I was
yeah,
just about to say that. Shout out to the nurses being the real heroes
absolutely.
in the health force. So I love that.
Were these nurses Black women?
They were.
Okay, in the NICU. Wow, Black
They
nurses
were.
in the NICU.
They were. It
That's
was
what's
the
up.
only one, but
Okay.
Oh, okay.
Hey.
Wow. So then how did you feel so when you say you were young, how old were you?
I was 18.
Okay.
Aww,
So being
yeah.
18, having your baby, and then your baby's taken away from you, right?
For 3 months.
Yes.
Wow.
That's a really long time.
Yeah,
Yeah.
it was an immediate, and it happened so quickly. Like after she was born, it just was like, oh, see your face, gone. And I was like, okay, what just happened? I couldn't even have time to process it. And like, the doctor that I saw throughout my pregnancy wasn't there for the birth.
Wow.
And so there was some random person who I didn't know, hadn't met before, wasn't told that was going to be there. And so it was really uncomfortable. And I just like had no idea what was going on.
Yeah, and you're in a vulnerable state, like a baby just ripped my
Exactly.
body in half here,
Exactly.
and then you stole her. So
Exactly.
Yeah. And
can
that's
I
what
at least see the baby, the person who ripped my body in half, please?
Like, where are you at?
Yeah.
And I was gonna ask that. So let's talk about like your birthing experience, since we're talking about racism and birth. Tell us about your birthing experience with your daughter from start to finish, like when you first started going to your OB appointments to labor and delivery.
So I started my care with a Black OBGYN.
Oh, that's really cool.
Yeah,
Wow.
she was nice and all, but I felt she was very like task oriented.
I was gonna say, whenever somebody starts with "she was nice," that means that's code for she was not nice, and I can't stand that. Heifer. That's what that's for.
Listen, I was with her because she was Black, but
Yeah.
But, however, common.
yeah.
Exactly. But yeah, I just felt like, she was like, oh, this is what you're here for. This is what we're talking about. This is, we're just focusing on your pregnancy. I'm not asking you other questions about you, what you don't know, what you maybe know. And that was kind of it. So I really just was like, oh, okay, I'm going, just to check up on the baby, and that's it. And so when I went into labor, I actually was literally around the corner from the hospital in a car. And I'm like, oh, okay, this feels really uncomfortable. Like something's going on. And so we called the ambulance. They came and picked me up and drove me
around the corner.
Oh my God.
For $800.
Yeah, okay. Did you dispute that charge?
I don't even remember.
I would have been
to
like,
tell
look,
you
I don't feel like what y'all did was worth the amount
At
'cause I
all.
could've
I mean, I wasn't paying. I couldn't, I wasn't even focused on any of that.
You was like, wow, we got there fast.
Yeah, I was like, oh, okay, we're here. Okay, great. And yeah, it just really went, it was like a whirlwind from there. I got admitted, and then they gave me an IV and fluids, and then the doctor comes in and just tells me, they checked my cervix, and that was it. They walk out.
Wow.
So they don't even are they talking to you? Or are they explaining what they're doing?
Not really. No,
Okay.
it was more of like, oh, hey, you're here and this is what's gonna happen. Bye. And so I spent more time with the nurses than I did with the OB who was there. And I did ask at one point, is the doctor that I saw gonna be here? And they were like, no, she's not here. Okay, great. And I didn't see the doctor.
He was
again
like, there's no
until
hope.
Sunday.
Like, there's no hope for the future.
No hope for it. No.
Wow.
So it literally just was like that.
Like, so your doctor wasn't on like call for her births
Nope.
or anything?
So, okay, were you early? Were you
I was
late?
early.
Oh, okay.
I was she was born at 35 weeks. And which they did tell me to expect that because of her condition. So
Okay.
I was prepared for her to be early, but I still didn't like fully understand what that meant. And then also, the trying to like process what was wrong with her and then how long would this process take afterwards and what's going to happen. And after she was born, and I think she spent the first 3 days in the NICU, and they were trying to allow so she was born with what's called gastroschisis, which means that she had a hole in her stomach where her intestines actually were out.
Oh.
And so how they normally kind of let it settle back in on its own, but they apparently, I guess, I don't know, were impatient and tried to force them back in towards the end, and her lungs collapsed.
Oh my gosh.
And she ended up on what's called ECMO, which they literally had to like clean her blood out, and so that
all of these Grey's Anatomy words
I
are
know.
coming
Oh,
back.
I'm a doctor, by the way.
On Grey's Anatomy.
So Meredith Grey is my person. That is my BFF.
Yes. Okay.
Yeah.
Oh my gosh, I'm so sorry that happened.
I'm like, whoa.
Yes, at 18,
So you're
I
18
just had a baby,
so-
and all this stuff is happening.
Well, so first of all, so I don't have kids, right? So in my mind, having a baby is a traumatic experience.
I would
I don't know
say
if that's
that.
true or not, but from watching it, it appears to be very, 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 very traumatic. I saw one friend give birth, and I just remembered the nurse like yelling at her, and I was just like, "I'm gonna kill her. Like, that's what's gonna happen." So I'm like, okay, so you've never had a baby, so you don't know what you don't know.
Yeah.
You don't know what's natural, what's not. You're just in a bunch of pain. How did they respond to your pain? Did you get?
They didn't. It was.
You had no epidural?
No.
Oh my
No.
God.
This story is getting worse and worse.
Right.
No, there was
There's
really
really like no hope in this story.
I'm concerned.
there was no response to like, I mean, I was in a lot of pain. This was my first baby, and like I didn't know what I was experiencing.
Why weren't you able to did you want an epidural?
I don't even think I had thought about it because again, throughout my prenatal care, we didn't even talk about it. So we didn't talk about options or like what labor would look like in any of that. None of that ever came up.
So when you were in labor, they never even said like, hey, because I believe there's a time frame where like, if the time runs out, you can't get it, So they never even said like, hey, we're closing in on this window.
No.
Wow.
This made you have a whole
they
baby.
sort of made you.
They were more concerned about like, because initially what I was told for her was because of her condition that I would have to have a C-section. That's what they told me initially.
Okay.
So I wasn't even like prepared to be having a vaginal.
Okay.
Oh.
Anyway.
Okay.
So when I
like
got
one
there,
could actually be prepared to have a vaginal birth, but okay.
cool.
I mean, like because you kind of know, like
Mentally,
mentally, you
yeah.
kind of know. Yeah.
But
You can
so,
just watch a video, I guess, right?
well, you probably don't want to do that.
You know, you don't freak yourself out. No. Like,
I
you
don't think that
already
would be a
know.
good idea.
Oh my God.
But yeah, no, so when I got there, I was like, oh, so we're doing this vaginal. Okay. So that was shocking.
And then everything happened so
It
fast,
happened
like
so
nobody's
fast.
talking
You're probably
to
like,
you.
if I'd have known this was gonna be vaginal birth, I would have waxed. I mean, now I got this doctor who I don't even know all the way.
Well, they was in there the whole time. You had to go to the doctor.
So you're in pain. They never offer you any type of pain meds. Like
That is
I guess I don't know what
crazy.
the other options are. But
IV
Okay.
is the other options. I mean, there's now nitrous oxide that's available now, but that wasn't a thing. So just IV or
how long was your labor?
it wasn't that long actually. So I probably was in labor for like 6 hours.
Okay.
Yeah,
That's a
no.
long time to be in pain.
It is.
It is.
It is.
That is a
Absolutely.
very long time
So-
to be in pain.
So you did know that your daughter had this condition while you were carrying her. So then they never explained what was going to happen as a result of that upon giving birth.
Right. So they told me essentially, oh, she's going to be in the NICU and we're going to do a surgery. And okay, that was it.
Okay.
Mhm.
So they didn't really explain what the condition was that she had and what the impact
They
would be. And-
Told me a little bit, like they told me, what it was and explained it in, those medical terms. But outside of that, I had to like do all of the research on my own.
And Siri wasn't even a thing.
No, Siri wasn't a thing.
I just keep thinking at 18, like I would have been like, what?
Maybe Google was a
But,
thing,
but you're already in pain, so who got time?
Right.
to,
Like
know?
I can't Google. I don't
Yeah.
know. I just know my baby's sick. Like that's probably how my baby is sick.
Yeah. So then it sounds like you also didn't have options as far as what they were gonna do to treat her.
Right. So they pretty much didn't give me any of the context of what would happen afterwards or what her like life would look like afterwards. So I did not know what to
Oh,
expect. In my
gosh.
mind, I thought, oh, okay, they're gonna put this back in, close everything up, and she'll be fine. Like,
Good
there
to
won't be
go.
any issues. That was not the case at all.
Oh.
And I didn't find out until much, until I got much older and much more health literate that, oh no, like they should not have done this procedure that way. And, there should have been more, support afterwards. I had to do all of that on my own and kind of reach out.
So they didn't even tell you how to care for her.
Nope.
After.
Nope. And so when I wanted to breastfeed, so that was a big thing, that I really wanted to do. And initially they were not very helpful with that process either. The nurses started really helping me with it, and pumping and stuff. So I would just pump. And I mean, I stayed at the hospital. I never left the whole time she was there. So I would just be pumping around the clock, taking the breast milk and giving it to them, put it in the freezer, and they would feed it through a tube. And so she ended up being sent home with this tube. And so they taught me how to
I was
like
about to say.
put it in.
But
and
you
stuff,
didn't know
but
that until it was time for her to go home. And they were like, hey, here's your baby and this too.
Yep.
And here's the instructions on this paper.
Oh my
like
God.
what?
I'm so
Yep.
look.
Was
now-
this in Milwaukee?
No, I was
this
gonna
is
say, I know
Philadelphia.
where she's going with this. Let me tell you about my friend, okay? I had a bad experience. She was like, I was on the phone telling her what's happening. She's like, I just left him a bad review. There.
Got
I'm like,
to.
you didn't even experience
Listen,
it.
18 years later, I'm still gonna be like, and
She
then
is ready to call the Better Business
I
Deal. That's what she
am.
wants to detail.
Okay.
So we're gonna have to talk about that off air.
Okay.
like what hospital? I'm gonna leave them a bad review. Like
So
Well, this hospital is no longer open.
oh
so-
good. See, look at God.
So you are handed your baby and along with the tube
Mhm.
and some instructions.
Yep.
Were they at least thorough? What like
I would say, I did go home knowing how to do it.
Okay.
But again, it was the like expectations.
well,
or, like,
why wouldn't
maybe
they
what could
have
happen.
let you watch them do it maybe and then maybe let you do it while they watch and then say,
Well,
hey,
yeah,
it's been now that we've watched this for 3 weeks or whatever, right? Or you're comfortable with it now. Like, now, mom, do you feel comfortable?
That is how you should do it.
This is an infant. So first of all, if I've never had a baby,
Uh-huh.
in my mind, this infant is really like a blob that I'm just trying to keep alive, right? Like I'm just trying,
Seriously.
to keep this thing alive. And so now my child is in a more vulnerable state.
Uh-huh.
I'm in a vulnerable state because
Right.
again, the child ripped open my body.
Yep.
That's
Never
too
did that
much.
before, right? So it's like it's like compounding trauma here. And then all of a sudden, I have to now add on this whole tube thing.
Yep.
And there is no stop to think about the layers of trauma at one time. It's just like everything is go because I got to keep this baby alive at this point.
Yep. That's where my mind was at. I'm her caretaker now. Like this is my baby. I have to
Yeah.
do this and do
But
this
you know
right.
what's so weird about that? This is why I have a problem with it, because before the day that you go home, there's only medical professionals that are taking care of her. You know
Yep.
what I mean? So it's like trained professionals. And then the next day it's like, here, I don't want to say like random person, you are her mother, but
you don't
here,
know.
non-medical person. Maybe
Right.
that's what I want to say.
Yeah.
Right? Like
Who's
here you
never
go.
had a baby?
Who's never had
Yeah.
a baby.
And who's 18?
Well,
at this
first of all,
point.
and that's the thing about not having a baby, you got to figure out what the heck you got to do.
Exactly. Exactly.
So, and now, okay.
That is
I'm sorry, I just needed a moment to
crazy.
catch
No,
up and
my
make sure that I
gosh.
understood what was going on.
And you hear stories like that about like Black women who've given birth, and they have these horror stories, and even just some like coming into this today, I was thinking about my own birthing story, and I was just like, yeah, that probably wasn't the best thing for them to do, but hey, here we are.
Here we are.
Which is really ridiculous, though, when you think about it. Like Sherry Renee said, like you should have been getting hands-on instruction about how to care for this child and how to make sure that, are you okay? Like, did anybody ask you, were you okay?
Nope.
That's crazy.
Nope. I literally, went through that whole process, probably just going. I never like really even stopped to process what really was happening. And even throughout, I mean, she ended up with medical problems up until she was like 5.
Wow.
And then, there was one point where she just completely stopped eating altogether. And I got scolded by a pediatrician who basically was telling me I was starving my child because because the feedings, she was still doing the tube feedings, and she would just like excessively vomit right afterwards. And I was like, explaining to him, like, I'm doing my best.
Right.
I, don't know what else.
Exactly.
So I don't know what else you want me
And
to
that's
do.
why I'm here talking to you, because
Exactly.
this is the situation that we're in.
Wow.
So it was hard. It was very, very hard.
Geez. Wow.
And when my son was a totally different experience, but I will say as far as the like birth process was for him, it was pretty much the same.
And I was gonna say you did it again. You had another baby.
Yep, I sure did. Wow. It was very far removed. At that point, I didn't need pain medicine, for that delivery at all. But
you already had the most trauma that you could ever have. So hell, what's the worst that could happen?
That muscle memory was there. Like I remember this.
I had this baby at home. Get y'all. Where's grandma? Bring Nana.
Yeah, I was completely, fine with his pregnancy. And I mean, it still had that same tone to it though. Really no education, no like teaching about anything. No giving me options of things I can do, none of that. And so, I just show up, ready to have a baby. And
so you're like this object.
Yeah.
That's like going through, like, it's almost like a factory, like, except for everyone comes to you, you're the workstation.
Yeah.
But everyone just comes to you and does stuff to you, but they're not like
interacting with you.
Yeah, like not interacting with you.
Yeah, not trying to get to know you. It's no connection at all. They don't try to like, really understand who you are, and let alone just giving you the basic education of this is what you might experience.
Questions? Are you concerned about anything?
How are you feeling?
How are you feeling? Basic question. How are you doing? How are you feeling?
Have you considered this or that?
At what point in your career were you when you had your son? Like, were you starting to do the nursing school at that point?
So I was not.
Okay.
I was actually going to be starting in that process after. So it didn't happen until after I had him, but I was a little more into like, okay, I'm gonna watch all the birthing videos ever, and like, just really starting to understand what all of this stuff really meant. And I still didn't even know the extent to how much trauma, Black women experience during prenatal care and during delivery and birth. And like after like even talking to my grandmother about my mom's experience, and she was telling me some stuff, and I was like, man, this is awful. Like this is not what people should be going through, and it's supposed to be a joyous time in your life, and it turns into a nightmare.
Absolutely. Absolutely.
When you were during your stay in the hospital, did you have a chance to observe how doctors and nurses were interacting with other non-Black patients? Probably not really in that sense. I don't think I really paid attention to it. You were just trying to figure out what was going on with your own baby. So you was like, I'm minding my business.
Yeah.
I don't have time to do.
Yeah. Okay. I don't think I really even thought about it. It wasn't even like,
you just experienced it and moved on.
Yeah.
Okay. Yeah.
That's interesting. Because I don't think I did either. Like I couldn't tell like if they were treating me any less than any other patient. But my OB was a trip, y'all. So she was in there with her little backpack on. I don't know why she just wore this backpack.
Girl, you a pissed off, honey. She said, I'm just coming, I'm gonna deliver this baby, then I'm gonna go to the side.
When I tell
Ain't nobody got time for this.
she had on like a Louis Vuitton backpack, like a Kanye West backpack. And it was so hysterical because I just kept looking at her in this backpack. And the whole time, like, she's like, oh, well, my other patient in the next room, she's about to deliver, so y'all gotta hurry. Like, she was trying to make us race. And I was like, but it's a baby. Like, I don't know what's about to happen. And then her and the nursing staff started to argue. It was just a hot mess in my room. And I was like, you know what? I'm having a baby. Like, bring the attention back over here. Like, none of y'all matter. It was so ridiculous. Like, just, I'm glad we're having this conversation because it did make me think back to my birthing experience. And it was like, I was in there and my son was 9 pounds. He was almost 10 pounds. So he was a huge baby. And I was skin teeth up until having this baby. So I'm like about to have this whole huge baby vaginally. I'm like, what is about to happen? Like, what's going on? Yeah. And again, nobody was telling me anything. Stuff was just going so fast. It was like a person here for IV, checking the heart rate. Like, it's just so much stuff happening that you don't even have time to think about what you're about to get yourself into. It's just, it was really scary, like thinking back on it.
You're just trying to get through Jumanji at this point.
Listen,
level
I'm
3.
trying to get through.
Well, hell, what's level 3?
What is next? And then my baby comes out. He doesn't cry like immediately. So I'm like, dude, what's wrong with my baby? Like, now y'all need to start talking. And then, you know, they eventually get him to start crying. But I'm just like, this is weird. Like, nobody just says anything. They're just going. I get they have a job to do, but you have first-time parents in here. Like, you need to make sure that they're comfortable. So it was a lot. It was crazy.
Yeah, it's like a checklist.
It is.
You check these boxes, and that's it. Talking to you is not on that list
at all. It was not. I remember a moment where before I got my catheter put in, like I had to use the bathroom, and of course I'm having contractions, and the bathroom's like far. So I'm like, I'm gonna pee right here. Like, I don't care. I'm having a baby. This is what I'm about to do. Okay.
Maybe this will get your attention.
So I had to use the restroom, but then they were still like slow to change my sheets and stuff. And I'm like, dude, it's wet. Like, no. Like, y'all need to get this.
Then how are y'all treating my baby in that other room when I ain't there? If this is how you treat me.
Listen, and when they would be like, you want us to take him to the nursery? No, leave him right here because I don't know what y'all doing. Right. So yes, I was definitely that mom.
Never mind the fact that I don't know what I'm doing either, but at least I know that I don't know.
Listen,
you just out here doing stuff.
I sure don't know what I don't know, but my mama know, and my mama's sitting right here. So. Shout out to mom. Listen here, my mom be knowing, so leave my baby right here. But just thinking about that made me think, like, I'm 13 years later and I did it again and I'm out. So it can really deter you from even wanting to have this experience when you know you have people that essentially don't care about you.
Absolutely.
Yeah. Wow. Okay. So now you have a second baby, but the first baby girl has a lot of complications. I would imagine that would even make you feel a certain type of way as a mom, like, you know, especially if you're getting scolded by the pediatrician, you're probably like, okay, did I not do something right? Is this my fault? Because you already don't have a baseline of information. So you don't know what to expect. So if whatever happens with her illness, you just think it's a result of something that you're doing. Not if it, you know, not considering that it could just be the illness, right? Or the I guess the illness just doing whatever it does.
Right.
So I can't believe that they didn't explain it to you. Like, that is
no, it was basically like, you know, this is what it is. This is her diagnosis. You know, we're gonna do this part and you do this at home. And that was it. It was like, you know, if that doesn't work, okay, well.
But not like, okay, and this is the type of lifestyle that she's gonna have. This is what is required for this.
Her quality of life.
This is what I've seen some parents do and be successful, while others have chosen to do this and that work for them. So if this isn't working, maybe consider that. And then you should really get, you know, follow-up care here, something.
No, none of that. I had to do all of that on my own. Like, at that point where, you know, the feeding became an issue, and I was like, okay, this is not working, and I need some help. And so I started looking for resources and signing up for these programs and getting occupational therapist to kind of help me to get her to eat and all of that stuff. I did it all on my own. And it wasn't until, so we ended up moving to Georgia, and it wasn't until I got there and got her into a pediatrician. And he like really helped me with her and kind of, you know, like her having that nasal tube for so long is what really kind of destroyed her and irritated her throat. That's why she stopped eating. Nobody ever told me that, you know, prior to that, and doctors never said anything about it. They never said, oh, that this can happen. You know, so she's having to go through all these testing and all of this stuff. And now she ended up with a tube now in her stomach. And so that was, you know, how she had to get her food. And it took, I mean, she didn't start eating solid food until she was like 3.5, 4.
Wow.
Yeah.
Wow. And then too, you know, obviously babies can't communicate, right? So they're relying on us to know. So it's like, okay, if you don't have the information, you're going to keep doing what the doctor told you to do, right? You told me to do this, so I'm going to keep doing, I'm going to be really good at doing this. But if you don't tell me what the impact could be, like, hey, make sure you watch out for this. This is a common issue with a patient that has this. So if this, then that, or something. And then when you go to the pediatrician, he basically calls you a bad mom. Like, I'm trying to ask for help.
That completely, like, you know, turned me off, and I was like, yeah, I'm not going back to these people
Absolutely.
anymore.
Well, now I'm gonna figure it out on my own.
I was like, this is completely disrespectful, and you know, I know that I'm doing what you told me to do.
And talk about your mental state in that moment.
I was completely. It took a while for it to like fully hit me, and then, you know, there were moments where I had like a complete just breakdown, and I was like, you know, I'm absolutely doing everything wrong. You know, I was blaming myself, like, you know, what am I doing? And, you know, why isn't this working? And maybe they are right. You know, I was going through that whole thing. And
well, they're the doctors, right? So they must be right.
They're the experts. They know more than me. So, like, you know, I must be doing something wrong.
It's just people in coats at the end of the day, clearly, because they don't know nothing about me, and I don't know nothing about them either.
So then I started like doing my own research and just kind of like finding stuff that would work, and it helped, and she got to where she, you know, is now, but it was a process for sure.
And that's what I'm saying, where, you know, for the whole 3 months you have medical professionals with her. So if something would have happened with her throat, they would have known what to do, and they would have known how to monitor and what to watch out for and what to look for, and what, you know, they could have played all the if-then scenarios, but then they just handed you the baby. Here, mom, who, by the way, only been a mom for 3 months, and not really, because we've been taking care of your baby. So, but good luck. Bye. Good luck. And here's a big ass bill.
Oh, that part. America. So, that's crazy. Wow. So do you think if they would have properly done her procedure like immediately after delivery, do you think she would have gone through some of those other things?
No. And that was, you know, something else that I again found out later on, like, oh, there's supposed to work groups out here for moms whose children have this, and oh, their kids look fine. And they, you know, there was none of this listed in, oh, these could be potential complications of this. So it was just like, wow. So this was literally from what they did to her. And, you know, years later.
And not only that, but isolating you too.
Oh,
because now you think, here's my one baby, one person in the world who has this issue, and everybody that I ask for help keeps basically blaming me. So, but all these other moms are together, happy. They soccer moms, you know, living a damn dream.
Kids are living normal lives, no feeding tubes or none of that. Which is, that would have pissed me off, like, to know that my child didn't even have to go through this. So you're putting my baby through unnecessary trauma. Like, she didn't need that.
Nope. Went through 4 years of absolute.
Did you sue them?
I thought
that's why this hospital closed.
No,
like, what happened?
I thought about it. You know,
is there a class action malpractice suit somewhere?
That's why she can't name it. It's still pending. It's pending. No,
seriously.
No, I didn't. I certainly thought about it afterwards, and I was like, man, you know, had I been more well informed.
But this is so common, though.
Oh yeah, very common.
Because even recently on the Red Table Talk, they were having this discussion, and the woman actually lost her baby. You know what I mean? So it's been just so many unnecessary either conditions or conditions that have exacerbated, because of just the knowledge transfer wasn't there.
Yep.
So it's just like, wow. So when you were in school, what did they teach you about racism and how Black women are being treated? Was that part of the curriculum?
Not in nursing school at all.
Okay.
Never came up.
Never in nursing school,
Never.
Wow.
even in your master's program, because you're
Not
A,
in
B,
my-
C, D, E, F, G, H, I, J, K, L, M, N, P.
All
So
the
you mean to
letters.
tell me that we went through all 26 letters and not name one time?
In my master's program, we touched on it. It wasn't.
It was a paragraph.
Like
Like
it was touched on.
Listen.
It little like tidbits here and there, and like some of my professors would kind of bring it up. But it's not in the actual textbooks. It's not in
It's
written
not
anywhere.
documented.
So unless you make a real concerted effort to say, I'm going to talk about this, it's not going to be brought up.
I believe it. I believe it. That's how Black Wall Street was. Little paragraph. And now all
Right.
this information
It was
is
like,
out there.
We'll tell you about the statistics.
Absolutely. Yeah.
Someplace in Tulsa, maybe?
I don't know. I don't even know, right? Could have been.
There's a
Yes.
theory that there were doctors and lawyers.
Yes.
No. But
Yes.
wow. Okay. So then eventually you say, you know what? It's really important to me that I want to be a nurse. What was your purpose, right? Like what were you trying to accomplish?
One, just being a face that looks like the people, who are being cared for, because especially in labor and delivery, so I never even got to be a labor and delivery nurse.
Wow. Okay.
Because they apparently, have a Black person quota.
Oh,
And
We said we already got one.
we're full. Next.
If you
What?
venture off,
Try Grace Sloan.
seriously, it seriously.
They don't have one. Did you see one in Grace Sloan? I didn't see one.
Apparently I could be qualified coming out of school. So this is how it starts off. So they actually feed this in your head in some of these nursing schools that you don't even attempt to apply for labor and delivery as a new nurse, because you're not going to get it.
Why?
What?
What's so unique about labor and delivery?
Nothing.
Okay.
You would think
You
that that's
still
the
have
one
to
people don't
learn.
want.
The skills, no matter what part of nursing you fall into, you still have to get that on the job training. It's
Yeah.
no different. Yet they would say, oh no, don't
I
even
would
attempt.
think because people are always going to have babies, right? Like there's no shortage of that. So look, they probably regretting now the pandemic hit and people having babies every 2 seconds.
Every
10
2
babies born.
seconds.
Right.
Listen, so many
So,
pandemic babies.
Yeah.
Which is crazy. Because
Wow.
even so our frame of reference is Grey's Anatomy, because we're not doctors.
Yes.
But even Joe, like they was looking at her crazy when she wanted to switch to
Uh-huh.
to pediatrics, and they was like, why? Like, why would you want to do that? Like, that's crazy. Or labor and delivery, or whatever she does. I don't even know her specialty, but the pink scrubs. They
She
was
works
like, no.
the pink scrubs and she works with the baby.
Yeah.
As a doctor, let me explain to you.
That is so crazy.
As Meredith Gray's best friend, I'm going to tell you that it's pediatrics.
Okay,
It's
there we go.
peds.
It's peds.
Well,
There
we call
go.
it peds. No, I'm making all
it's
this up.
peds.
I have no
Okay.
clue. Don't trust me. I know
Very-
nothing about none of this.
Yeah.
But okay, so then you were like, so what was you were like, okay, I want to be a face that looks like me. Okay.
Mhm.
So then how did you get into, so then what made you say specifically midwifery? Am I saying it right? Okay.
Midwifery, yeah. It was just something that called to me. I like really enjoyed watching it on TV and like birth, and like it always just really sucked me in. Like looking at it, I was like, man, this is interesting.
Wow.
This is really, like a powerful moment in a woman's life. So like I want to be a part of that.
Yeah.
But
The way that you wish somebody would have been a part of
Yes.
yours.
Mhm.
Yeah.
Yeah.
absolutely. It's
That's
like
how
you see all
purpose
these
works,
beautiful
man.
birth stories,
Yeah.
and they're not us.
Oh, I know, right?
So it was like, okay,
Unfortunately.
so I thought, going into it, with the nursing part of it, okay, being in the labor and delivery, like I love talking to people. And so like, these are prime times for me to just educate people.
Oh, okay.
And, being able to kind of be their labor support and, talk them through things, be that person who, I didn't have. And like I said, I couldn't get into labor and delivery.
Mhm.
And then
So you found a back door,
Yeah.
midwifery.
Yeah.
I got a back door, and I said,
Listen,
I'm gonna do
gotta
this.
make
We
my way.
said by any means necessary.
I'm
Yes.
gonna make my way. Don't y'all worry.
Yes.
I love it.
No, that's
So
dope.
are you currently like practicing, or do you do more instruction?
No,
Or do you do both?
I'm practicing in a practice at Aurora Sinai. So
Okay. I was born in Sinai.
I
Never
do
mind the fact
full
that you just
scope
left them
care.
a bad review on your bestie's behalf.
That was different.
That's neither here.
Absolutely.
Look,
That was different.
That's neither here nor there. But whatever.
They was messing up.
Well, hey, you gotta do what you gotta
Hey,
She was
got
like,
to.
which location? All right.
do.
I was like, are you going there? Why do you need the address? Like,
Yeah.
what?
That's so
Hilarious.
serious too. Hilarious.
No, yeah, I'm practicing full scope. So I do, like I said, from prenatal care all the way to menopause, GYN care, all of that.
The whole shebang.
Oh,
The whole
shit.
woman. You're
The
taking care of the whole
whole woman.
woman.
As it should be.
That's
As
dope.
it should be.
But
done.
then you also are sort of being an advocate and hosting, how do I want to say it, sessions educating the general public on racism
I
as it
am.
relates to.
I
the
am. I
delivery and
not
pregnancy.
only with the general public, but I'm also doing it for our residents and
Nice.
all
Nice.
of the new.
Because we're a teaching hospital.
Oh,
Yes.
hello, Graceful.
Yes.
Like Grace Flower.
Yes, a
Okay.
teaching hospital. So I do these sessions also for all of the residents, family practice, the medical residents, the OB residents, and even staff and faculty to try to
Oh, that's
really keep this conversation going.
Going,
'Cause
yeah.
It seems to butt up here and there when something major happens, and then it just goes away. And like, no, this is
Yeah.
everyday life.
Mhm.
So there's no going away. We need to continue to keep working at this.
Mm.
Wow.
Yeah, I had a chance to listen in to the session, and there was a lot of statistics dropped, and I was just like, and every single slide was like, what?
Mhm.
Good thing we're not all on camera. Jeez.
Right. Because they see my expression of
Right.
horror.
Oh
Um,
my God.
It's really crazy because I feel like even throughout my own experience, like I never attributed to like, oh, this is racism. Like,
Mhm.
because it's so, you just don't realize that when you're in it. But I didn't
But
really,
you also don't have a baseline, right?
right.
So,
And I that was my first experience, like being at a hospital, like staying at a hospital. Like I had no prior knowledge to any of that.
Mhm.
But I don't think I learned about like the horrors of racism in medicine
Mhm.
until like I must have been on Instagram. I follow some page and they were talking about how they would kind of practice surgeries on Black women.
Mhm.
And I was like, that's crazy.
Mhm.
Like, and that's why, generations after generations, like Black women have this, they assume we have this high tolerance to pain because of what was done to our ancestors.
Not just high tolerance, that we don't feel pain.
But that we don't feel,
Well, I
that we don't feel
I
pain at
think
all.
It's a compilation of things, right? So at one point it was, you're not all the way human,
Yeah.
right? You're not a
Yep.
whole person,
Yep.
right? What was it? Was it
3/5?
3/5 of a person?
Yeah,
3/5.
So you're not all the way human,
Mhm.
right? You are barbaric, right? So
Mhm.
you're an animal, you don't feel pain.
Yeah.
And then also there was a language barrier when we were slaves. So when we were giving birth, nobody was going to explain anything to us because we couldn't understand it anyway.
Oh, no.
Yeah.
Right. So
It-
why should I talk to you, Black
Birth was a
woman? Have the
money-making
baby.
business.
Absolutely.
Exactly.
Oh, you have
Yeah,
the
you're
baby.
being-
Yeah.
Well, you're cattle. So
Yeah.
I'm breeding you.
This is a business.
Right.
Yep.
So because I need more people to work my land. So
Yep.
I'm literally breeding you. I
Mhm.
don't care if you're in pain.
Nope.
And we don't speak the same language anyway.
Nope.
So there's just so
Wow.
many
Layers,
layers.
yeah, you're right.
Yeah, so many layers. But
You're right.
and it's so funny because in different areas of life, I'm not going to say that you can escape racism, but you can become oblivious to it
Mhm.
because of your income.
Yep.
But when it comes to healthcare,
Mm-hmm.
it doesn't even
doesn't
matter.
matter.
According to the statistic that you gave
Yeah,
in your
it
amazing
doesn't matter.
presentation, it literally does not matter. And on the Red Table Talk, the young lady that was there, she said she made a lot of money. She specifically went to the best hospital, it was all white. She was like, yep, I'm about to have an amazing birth experience. And she lost
And her baby died.
her baby.
Oh my God.
Yes, because of them.
Oh my God.
Because of them. And she was like, there was not an amount of money that I could have had
Nope.
to fix this.
Wow.
Money doesn't matter when it comes to that. This has been, and these statistics that I had talked about are literally the same as they were back in slavery.
Oh my gosh.
And for different reasons, but
Whoa.
the actual underlying cause of it is the same. It's all
All
to
the
do with
same.
racism.
Mhm.
It doesn't change. It just looks different
Right.
throughout the years. And so it's
Wow.
like, trying to, have that conversation about it, and it's like bringing that into it. People are like, no, there's no way this can have, anything.
I will say it does sound weird, because it's like, I would think if I was a nurse or a doctor, I would be like, I can't, like, why would I go to one patient and be like, oh yeah, let me explain this to you? Or are they demanding more? Like, I don't know.
No.
It's like, it's just so weird, because like, why would I go to one room and be like, oh yes, and and there's this option and 17 options, and then go to the next one and be like, all right, you got 5 minutes, then I got the next patient. Like, what? It just seems so weird.
Deep-rooted
It's
racism.
already, this is on paper, okay, I see what your race is. And so there's already put on like,
Oh, and here goes another young mother, another Black welfare
let's look
mother.
at their age, their
Uh-huh.
name,
She
their
probably,
race, and
they
I'ma
probably ain't
judge
even
you right from
married,
there.
right? They just go ahead and they already got the script, right?
Already in
They
there.
have a predefined file in
Mhm.
the head. So then when I see you, it doesn't even matter.
Mhm.
I don't even, never mind the fact that you have like a big ring on your finger or whatever, or even if you don't.
It
Because
doesn't
it
matter.
really don't matter, right?
It's about taking care of the human. Like, are you
or even
for
caring
me?
enough for the baby, right? To just be like, okay, let me just, like, that's just so
But that's
weird.
that deep root.
But that's the beauty, and I shouldn't even say beauty, but that is what is quite amazing about systems.
Yeah.
Is they just run.
Yeah.
It doesn't, you could probably even have some Black nurses and Black doctors that still succumb to the system.
Oh yeah,
Absolutely.
Absolutely. Because they get tired of having to be the one to say something, or don't want to lose their job because they said something, or get penalized or be the outlier. And so you just fall right in line and do what everybody else is doing and ignore it and act like it doesn't exist. It happens all the time. Like, you hear people say stuff. When I worked as a postpartum nurse before becoming a midwife, some of the stuff that I would hear, I was just like, are we okay with this? And I would go to my manager all the time and like, this is not appropriate. This is not okay. And like, I don't care if I get in trouble or written up, or who doesn't like me.
Now you have your sister Locke, you probably had on a nice sheet when you were there. You have an African print nursing uniform. Yeah.
Being bliggity black.
I mean, you get a damn coat dance on your way in. You said, just so we're clear.
But that's crazy, because like you said, those systems just doesn't change. The time changes. But those systems don't change at all. So
crazy.
You got Black people being scared, they shucking and jiving, they, they don't want to get punched.
And we're used to, being treated differently because of our race. So we're just like, whatever.
Right.
Just, is the baby good?
Right.
Like, we literally, I think, settle for minimum requirements in a lot of, spaces, because number one, we don't know because there's no baseline. We think if I can bring my baby home, we good.
Yeah, that's it. As long as I get my baby.
Did she come home and is it the right one? Because if so, we're good.
Right, we're good.
Yeah, there's like nothing else outside of that. I mean, I get patients all the time who transfer from other hospitals and stuff because they're like, they had such a bad experience, or my doctor just didn't even listen to me. And so like, I'm like, they come in for their first visit and I'm like giving them all this information. I'm like, hold on, we'll space this out, because I know I'm giving you a lot of, and they're just like, oh, because you're excited, like, so helpful, and like, thank you so much. Like, nobody even talked to me about this, or nobody, and it's like,
the whole idea that my doctor didn't listen to me
is scary.
That's scary.
It really is scary.
I mean, just
because while I may not know medicine, I do know my body, right? I've had it all my life. Absolutely. So if I say I'm hurt, then I'm hurt. Absolutely. The lady on Red Table Talk, this is what she said. She said when they would come in and ask her what her pain was on the scale of 1 to 10, she said she would negotiate with herself on what number to tell them, because she said that the nurse kept saying the doctor doesn't like complainers. The doctor doesn't like complainers. So she was like, okay, if I say that it's 10, he's gonna leave. But if I say it's too low, then they're not gonna think that I need help. So 7.
Which is, why do we have to even rationalize with ourselves about how much pain we're in? Like, Look, I'm telling you,
in
it's a 10.
labor. Hello.
Right.
Again, a
It's
baby is being ripped.
crazy.
It shouldn't
From
even be
my
a
body.
I'm
discussion.
telling you, an 11, bro. It's off the scale. Like, I'm hurt.
Yeah, it's like that. I mean, even throughout, just my basic going through my medical care, I've experienced a lot of times showing up to the doctor and telling them like, I literally have like chronic pain.
Mhm.
And they were all, well, nothing's wrong. You're okay. This is it. I'm like, no, I shouldn't be feeling this. I should not be in pain.
You're
Yes.
okay. I just said I literally
I'm
just
young.
said that I was not okay.
Yeah.
And you
I was,
literally just
in
said
my
you're okay.
20s, and
I
I'm
don't
like,
understand.
something's wrong. And it would always just be, no, it's nothing. You're fine. Or, or it's, I'm going to take you through the ringer and send you to all of these other specialists
Mhm.
To
nothing.
tire you out and take your money.
Yes.
Exactly.
Yes, and still get no answer in the end.
Listen, I feel like I'm going through that right now. Like, look, I'm trying to tell you it's one thing. You got me going to X, Y, and Z, and I don't even want to go to none of these appointments because I'm telling you, like, what you went to all this medical school. You don't want to try to figure it out. Like, make your degree work for you. Like, God.
It doesn't suit them. They're not gonna. It's like whatever you're either drug seeking or
Yeah.
Oh, God.
or you're a complainer. So
Oh
that's your options
gosh.
right there. Yeah.
Mm. Wow.
There's so much that we don't know though. I forgot what it was, but I was going to the doctor for something. And I was talking to a Dre, and you were like, "Oh, Joe, she doesn't have to do this. They're not supposed to do this. She could do this." And I was like, "Oh, those are all options." I thought it was literally one path. Maybe it was an annual checkup. I don't remember, but I was just like, "Who knew
It's
that I had all these options? This is fun." You know what I mean? Like I
Right.
can't, because it's just like, yeah, I don't because then you're empowered.
Yeah.
You're more like, you know what, I don't want to do that today. I'm just gonna do the A package.
Yeah.
Okay, I'll do the C package on another day.
It's just
Absolutely.
another luxury that you didn't even know you were entitled to.
But not only that, but I think when you are empowered that way, then you're more likely to not just get it over with. You're more likely to
Right.
be like, when they're like, do you have any questions? Do you have any of this? You might be like, actually, yes.
Right.
What is this? What about that? Or, something. But if every time I come in, it's just a standard that I'm just gonna, okay, I always say no, so no.
Yeah.
Mhm.
I always say yes here, so yes.
Mhm.
Yeah.
It's kind of like just get it done.
Yep.
Yeah.
And
And
then get
then-
over and get out.
See you next year.
Exactly.
Yep. I mean, it like even sometimes I'm always like telling, my patients, like, there are tons of different ways you can do things. There's not just one.
But
right
nobody
way
ever
to
told
do
me. I was
it.
like,
Yeah. Like,
Yeah.
what are your preferences? And they're looking at me like,
Wow.
what do you mean?
You asking me
don't
my
get
opinion?
Right. Like, geez.
You're the medical person asking
that's like,
me.
do you want cheese with that?
Right.
Actually, hell yes. What kind of cheese?
Listen.
Oh, there's options of cheese.
Right, we got options. Yeah, you do be shook with options. Like, oh.
But you know what? That's probably why they don't do it.
Yeah.
Because they're like, because then I gotta explain each one of them to you.
Right.
And then, so they probably, that's why it's work for them. So,
Oh yeah, absolutely. That's why, like, with this, with the discussions that I've been doing and kind of like telling medical professionals that you should have these conversations about racism and ask your patients about, what experiences have they had, because this contributes to the amount of stress that people experience on a daily basis. And they're like, like that makes them nervous. And I don't want to talk about that because then I have to get into all this other stuff. And then your visit's going to take too long. So yeah, I don't have time for that.
Yep.
And that's how it goes all the time. It gets swept under the rug.
Every time.
And you know what else is crazy is that even like with COVID, a lot of people would be like, I'm not going to I know I tested positive, but I'm still not going, I'm not doing this. Because they're like, if you go to some Black people, it's like, if I go to the hospital, I'm going to die.
Yeah, they definitely have that
They're
fear.
gonna put me on a ventilator. They're not gonna come see it. Like they literally will fight any type of procedures. When people learn that they have a condition, they literally fear. They don't even fear the damn condition.
No.
They fear
going to the doctor.
Yeah.
And going to the hospital.
And fear of being in debt. Like the fear of the cost is
yeah.
another huge thing. It's
Absolutely.
like I can't even afford, like literally people say I can't afford to be sick. Literally can't.
No, you cannot. I mean, even with the basic, like there are specific, obviously, conditions that some Black women just experience. It's just part of our DNA. Things like fibroids. And it amazed me how often the automatic treatment is, well, just get a hysterectomy.
Yeah.
Wow,
I
they
see that
said
so
no.
much. Yeah.
Take out the whole, just take it out.
Yeah. Yes.
You don't
Pretty-
need kids or anything.
No. And so that it was always the answer, because that was a quick way of
Mhm.
sterilizing you and
Yeah.
stopping Black reproduction. And
Yeah.
that was, that came from slavery. That's how,
Crazy.
things were then. So, and when I would talk to women about other options, that this is not the only option. And like, no, we're not just about to take your whole organ out.
Jesus.
And they were like, what? There's other stuff I can
But
do?
you
What do you
know
mean?
what though? That makes sense because there's so many things that we as a community see and we think that it equals something else. Like,
Mhm.
oh, diabetes, cut off the leg. Like,
Right.
you know what I mean? Like,
Immediately.
it goes immediately to
Yeah.
to that
Something-
because
yeah.
that's what we've seen.
Exactly.
Yeah.
So, wow.
Exactly. And then, if you find that people who get into holistic care and kind of stuff like that are like demonized and like,
Yeah.
you're a terrible person. Why are you doing this? This
Yeah.
is not going to help you and all that. And it's like, no, that's not true.
Right. Or you're like a witch or a crazy
Yeah.
person. Like,
Yeah. When you
other
are literally
options.
trying to find something else other than what they're telling you to do because
Mhm.
you're terrified.
yeah.
You just want to take something out of me, or, like,
Give me all these drugs.
exactly.
But
Exactly.
no, no
Exactly.
thanks. That's for y'all to make more money.
Exactly.
Like, no.
Yeah, because it's a whole game.
Mhm.
So,
Whole
don't even
game.
add in the drug.
Yeah, it's the whole
game.
system.
But the whole idea of a baby actually being born directly into racism,
Mhm.
that is just mind blowing. It's like, can I at least spend the first year of my life just,
That
being
is crazy.
yeah, like you're directly
Yeah.
just immediately
Yeah.
born into racism. Like that.
Day one.
Yeah. Oh, the baby's black.
You were discriminated against. Day
Day
one.
one.
Yeah, it's me. I mean, like
Like
even-
it ain't even funny, but this is my
Terrible.
uncomfortable
But it
laugh. I'm
is.
like, what?
and they don't even,
Oh my
it's
gosh.
and it even can be something as basic as, the nurses calling a baby a monkey, or
Oh my God. Yeah,
little
here's your
devil.
little monkey.
Yeah.
No.
stuff like that.
First of all,
that's their first experience into racism. There you
yes.
go.
Yes.
Just like that.
And I've had heard that. Here's
Oh, it
your
happens
little
all the time.
monkey. No, what?
It happens all the time.
Monkey.
Oh my God.
Yeah. Mhm. I've heard it. So
Oh yeah, or he's gonna be tall. He's gonna be a football player.
Yeah,
like just
it's
little
always-
microaggressions.
Microaggressions.
yes,
Yeah,
Oh,
like
man.
nah.
all the time.
He's gonna be a doctor. Okay, shut up. Like, what are you talking
Right.
about?
But it's just, it's almost like you have obviously with us being visibly black, right? Like there's no way to escape racism, but like the fact that literally on day one you're traumatized.
Yeah.
And then that becomes your way of being. It becomes something that's what's the word? It becomes a pathology.
Yeah.
It's like even if racism ended tomorrow, we would all still move around in life the way that we do. It's almost like, how horses, you can tie them up to a tree. Is it horses? But then you can take the leash off the tree.
And
But
they'll still
and
stay.
But they will
stay
still
That is
stand
where
there.
horses will.
Yeah, they'll just stand there as if they're bound to the tree
Yeah.
because they have no idea that they're free.
Yeah.
Yeah.
So
Yeah.
even if, for some reason racism literally just disappeared tomorrow because we experienced it right at birth and that is the baseline.
Yeah.
Mhm.
Like I really just think that we would still behave.
Oh
Yeah.
yeah, it changes
I
the
agree.
course of your life.
Absolutely
It
does.
changes your brain chemistry. How those stress levels are deep. They
Yeah.
don't go away.
Mhm.
And so even in the womb,
Yeah.
there's
In
always a
utero.
change there.
Marinate in it.
Yeah.
Jesus.
It's a ripple. Like if you touch the body of water, like the ripples will
Yeah.
keep going and going and going. That's what it is like to be black.
Yeah.
Like it's
Yeah,
forever.
trauma affects
and
every
ever.
single generation
Yes.
as it goes. It does
Mhm.
not change. So it is.
I mean, Iyanla can't even fix it. Like this is crazy.
It's bigger than yeah.
It's bigger than Iyanla.
She can't fix America.
Dang.
Crazy.
No.
It really is
Wow.
a trip.
So then when you are in your everyday work, do you find yourself like correcting other nurses and even doctors or staff saying like,
Yeah.
did you explain this to okay.
Yeah.
Is there an
Occasionally it
example that
happens.
you would like to share for the class?
Be checking people like, hold up.
Uh-huh.
I heard you with that patient. Ain't sound right.
You pull out your Black Lives Matter notebook and
With the black fits on
With
there.
the-
I mean, you know, it especially when especially in times where there's like some, you know, somebody was killed by a cop. Those are the times where the conversations turn real negative real quick. And you kind of find out those people that you work closely with that are just okay.
This is what they think.
Yeah,
Yeah.
really deep in there in that racism.
Yeah.
And you know, so a lot of times that's when a lot of heated discussions happen, and you know, it's brought out to the patients and stuff. So you hear, you know, kind of things being said, or oh, this person. So a particular incident that happened was a patient who, you know, was having some, you know, social issues between her and her significant other. They were just arguing about whatever, and you know, but it was contained. It wasn't, you know, anything that felt like the patient was actually in danger or anybody else was in danger. But you know, some of the nurses felt like because he was a big black man, that he was going
a threat.
to do something to them, and so
He was going to do something to them.
Yeah. And so
Wait, so they weren't even concerned about the mom?
Not concerned about the mom.
Oh, no.
I need help today
Yeah.
because I needed to make sense.
You said we don't feel safe.
No,
Yeah.
no, they don't feel
Screw the
safe.
mom, you know,
So
the
let's
one
call
who's vulnerable.
security.
We can leave.
Yeah,
She's
yeah.
bound to the bed.
Yeah, let's call security. And then it was, you know, the patient got, you know, upset about it. And was like, you know,
Yeah.
like, I don't want him to leave, you know. And so then like her and the security guard, you know, were going back and forth, and you know, the nurses are in the back laughing and making this is funny.
My
And,
God.
you know, this is what they get. They shouldn't be acting like they, you know,
They.
Oh, not the day.
hell yeah. And so it was like, no, like that's not okay. Like this woman is in labor.
And you're inciting more trauma
Exactly.
on her.
Always.
Exactly.
Always.
Like, how about you?
unnecessary
Right.
drama.
You could have pulled, you know, had him step out, and you had a conversation with her to check in and see, are you okay?
Yeah,
Right.
you good? Do you want him to
Is
stay?
this-
Do you want him to
'cause who
leave?
knows? This might be their normal banter. Like he's not
Absolutely.
physically harming her. He wasn't, you know, saying anything that you thought, okay, yeah, he's gonna like do something to her kind of thing. So like you just check in and ask.
And that's
you
all
just
you had to do.
assume. And now you escalated this whole situation. And again, she's in labor.
And she's making the request for him to stay.
Exactly.
And you all are back here very entertained by what
Yes.
you all have just
Yes.
created.
Not, you know, I'm so scared. Now
Right.
this is
Now it's
fun.
entertaining.
Yeah.
Right.
Yeah.
Yeah. So you know, that, you know, is what prompted me also to have the discussion and start that presentation. So I was like, yeah, you know what? We got some issues.
Very
Yeah.
much
Yeah.
Got
so.
some issues going on. I
Wow.
mean, just being from Philadelphia, I've definitely experienced a lot of racism. But I will say coming here has been a whole nother level for me.
Oh yeah, welcome.
Yes.
Welcome to the
Yes,
most
yes.
segregated city
Yes.
in America.
In America. Yes.
Yes. That has been interesting. And you know, just because I graduated from Georgetown,
Okay.
I get a whole lot of interesting reactions to when I say that. And you know, it really gets under my skin.
Oh, I bet. They weren't
And
expecting.
no.
Not at all. They want you to be the exception. They
I
don't
mean,
want you to be the bleeding black. Like, I know what I'm talking about.
Exactly.
They want you to be like, oh, but you're cool.
Yeah.
That.
I mean, I literally had an interaction where, you know, I was at a class to do some neonatal resuscitation stuff. And the woman is, who was a white nurse.
By the way, that sounds very complicated. You just move
I
past
know.
it. I'm just resuscitating.
Just saving the baby,
neonatal,
you know,
I'm saving a life.
Yeah.
Nothing too big.
Yeah, just
Light
say-
work.
But she's like, you know, oh, like, you know, we haven't met. And so she was like, oh, what school did you go to for midwifery? And I was like, oh, I went to Georgetown. She was like, oh, it's this high pitch. Oh, and I've heard it a number of times. So I
It
knew exactly.
crescendo.
Oh, yeah.
Wasn't
I-
expecting that.
Yeah, I knew exactly where it was coming from. She was like, oh, that's really good. And then so she asked, another one of my colleagues was there. And she asked her,
She went to go finish. Go ahead.
she asked her, she said, oh, and what school did you go to? And she was like, oh, I went to Marquette. She was like, oh, okay, that's nice. And I was like, that was different.
Yeah.
So I immediately knew it was like, oh, you went to Georgetown.
Mhm.
And I get that reaction every
yeah.
single time.
Yeah.
And it is so frustrating. 'cause it's like,
Yeah.
Yeah, I did.
I did.
You
And
know,
I would have been like, where did you go?
Yeah, that's what you should
Since we
do.
being petty, and where did you go? Just so I can stun on you real quick, okay?
Right.
Where did you go?
it's crazy to
Oh
like
my
really even
gosh.
think about how like that is like such
Well,
a
I think it's because, right, I think the general assumption is that, there's some quota that has to be met. There's some sort of affirmative action, like we
Oh,
don't
of
deserve to be here.
Oh yeah.
So then, and like most Black women do, we have to go above and beyond and have the best and the finest of credentials, right, and outshine just to get on the same level.
Yeah.
So then when we are questioned by our peers and they see that, no, my dear, I actually deserve to be here.
yeah.
And
Absolutely.
actually, I'm a better pick than you.
Absolutely.
By the way, I'm not going to say that, right? Because I don't have the ego, but I will. But honey, since you asked the question,
Hey,
I will give you the answer.
hey, since you asked, I got to stun on you just a
Right.
teensy bit.
Exactly.
Just a little bit.
Absolutely.
Have you ever found that people that they don't believe you, like they're asking you, like kind of like trying to verify?
Oh, of course.
Oh my gosh.
Of course. I mean, my whole experience throughout my clinicals through school was awful. The level of like, you don't really know anything, or it was kind of there were times where I literally wanted to like give up, and I was like, I can't do this anymore.
God.
This is rough. Like being in these environments with patients who, when I would walk in the room and they would be like,
Yeah, I was gonna ask you that. Have you ever had a patient like
did y'all
request
see that
somebody
it was a
else?
TikTok and it was like, oh, when they said that they don't want
And it was the whole staff was
the
black.
whole
I
staff
love
was
that
black.
TikTok.
But what did they say? It was like when they don't want someone Black to work on it. It was
Yes.
like, okay, and it was like,
But
boom,
the
boom,
whole
boom,
staff
and they all
was
just
black. The
yeah.
nurse, the
I mean,
doctor, the anesthesiologist, like the whole
even
staff
the elder
black.
like spin around and dropped it real quick. Like,
Yes.
all right, well, fine. Well, don't be helped because everybody in here is
The
Black.
whole staff. That was also on 911 too. So I'm
That
also a
was
firefighter
so
and officer
dope.
because I watched
Yeah, me too.
911.
Uh-huh.
So the dude, the paramedics showed up and the firefighters, he was like, nah, I don't want y'all to do it. Like, I want somebody white. Like, I don't want y'all.
Yeah. So you got people do that?
oh yeah.
Oh my
Yeah,
God.
absolutely. Especially
How do they say it?
so they won't tell me.
Oh, okay.
They it would be kind of
Because
like
they wouldn't want to offend you. My
yes,
God. So,
no. They would just tell, the person who was precepting me, like,
Mm.
and so, my precept would come and just say, they just don't want a student. That's how they would say it. But I know it.
oh, okay. That was the translation. That's how it got fed back.
I mean, I could tell immediately, by the look on their face when they saw
So then,
me.
does that mean that you don't get those hours counted, or what?
No,
does that
I would
mean?
still get my hours.
I
Thank
know
goodness.
that's
Okay.
right.
But it was, it was an experience that I didn't get.
Right.
Yeah.
And so
And all
that
those
was tough.
things add up. It's like, okay, so number one, y'all traumatized the hell out of me when I just became an adult. I was 18.
Right.
And, you traumatized me and my child, my firstborn.
That's
Now I'm trying to make a difference and be for others what y'all weren't for me. And then even going through school, people are questioning, should I be here? Then, I make it, I'm trying to precept and learn what I need to learn. And then I'm being denied opportunities.
because
So
of
like
my
all those
skin.
things just compound.
Yeah.
It just adds on, and it really, makes you question, why am I even doing this?
Yeah.
Why?
Yeah.
Wow.
But it's worth it.
I know that's
Well, now
right.
you out here catching babies.
I
So
am,
Yes.
I am, and I love what I do, and I love my colleagues. They're very supportive, so it's been a good experience after. And that is also, one of the reasons why I really, really want to also precept people, because
Nice.
I don't want anybody to have that
be
same experience
denied.
that I had. Absolutely. And also with, there aren't a lot of Black midwives out there in general.
It doesn't sound very Black. I'm just gonna go the naming convention in itself. It doesn't sound like something that a Black woman would do,
But I feel like Black women have been doing it for years.
Black women
like,
were
they
the
had a
ones who
choice.
did it.
Yeah,
Yeah, right.
absolutely.
They started it.
Yes.
Invented, discovered.
So they were doing it, and and now it's like, probably
Honestly,
less
it
than
sounds like a
6%.
white option. I'm gonna be really, really honest with you.
It
It
does.
sounds like
It
a
does.
white
It does.
option.
It does. Even as when I was learning about pregnancy and birth and all that stuff, I was like, oh, midwife, you gotta have money to do that.
That's what I thought.
That's what I'm
Yeah.
saying. It sounds
Yes,
like the
have
A
money.
package.
Yeah.
But I just want the seat.
I'm gonna just go with a regular doctor.
I just want exactly. I just do the basic care. Thank you. No funds for the upgrade.
Actually, I would like a nurse to deliver my baby.
Actually, you know what? Bring me some cows and my mama, and we good.
Cause man,
You know, and that's what always like baffles my mind about the whole idea about Black women either exaggerating pain or just, you know, wanting to come to the hospital to get drugs, because I feel like as a community, if we don't feel good, we be like, go lay down, drink that ginger ale,
take some Robitussin,
get them saltine crackers.
and that's it.
You know, because we always have this concept of this idea of, you know, I don't have time and I don't have money to do this.
Yeah.
So we know that ambulance ride is gonna break us.
Yeah.
Right. So number one, if we do go,
we ain't calling that.
I have seen people catch the bus
To go to the emergency room.
to the ER.
Yeah. I'm not getting in that.
I
Don't ever call it.
Because they refuse. It's literally like, I literally rather die first.
Yeah,
like, that's
literally.
like that's crazy. So that's why like the whole idea, it just kind of goes to show how out of touch people are with our community. Because it's like, do you know how bad you have to literally be on your deathbed as a Black person to actually get in the ambulance?
Yes. Yeah.
That's why, you know, it for Black women who are pregnant, this is the most exposure you're getting to healthcare. Really.
Oh yeah, because we ain't gonna go.
No,
we don't
go
go.
anywhere.
Yeah, like
I mean, look,
that was my very first experience at the hospital,
Yeah.
like ever in my life.
yeah.
If there's nothing else wrong with me, I'm not going. I don't need to.
And that's like we don't just go because we got a tickle in our throat or whatever.
Exactly.
Like these have to be like, you need to either see real blood,
real blood.
real blood. I ain't talking about that fake blood,
Nah.
like a little scratch.
Yes, real blood.
Did you bandage it up?
Listen, you took some ginger ale.
Exactly.
And some Robitussin.
And did you eat the saltine crackers? If you're bleeding, eat the saltines now.
Yes. Real blood. Something needs
Oh.
to be falling off.
Did you lay down? Right. If you ain't laid down, it's got to be about 3 to 6 months that it's continuing and actually getting worse for you to actually go see about it.
Which is so sad.
I feel like Black people will have like they spleen hanging. I'm like, oh, that ain't nothing. That's just a spleen hanging out. All right,
I'm
now
good.
where was we in this conversation?
I
Like,
don't need
what?
that organ.
I don't need that. What is that for anyway? Take that out.
And I was like, appendix, like, who
Exactly.
needs that? I don't
But
know.
it's even like that now. Like I'm working in my career, like I make a good salary, and still, like I still will talk myself out of going to the doctor
Absolutely.
because I don't want to pay the copay, which really pisses me off. Like I got insurance, and I still got to pay this high copay. Like I don't
Let me tell
understand.
I'm a medical professional, still don't want to go.
Let
Listen,
me tell you, but look, I have really great health insurance too. I don't even have to pay the copay because my employer gives me a card in which I can expense the daggone copay. I still
that's
don't want to
crazy.
go because I don't want the experience.
No, yeah.
I don't want the
you don't wanna do it,
experience.
yeah.
You saw what happened when I went just to go see by my daggone hand.
Yeah,
And I'm like, y'all ain't gonna do this to me.
yeah, it was a mess.
Like, cause look, you can only take stuff for so long. So
Absolutely.
unless I feel that it's medically necessary, I'm not going.
Mhm.
Like literally problems have to persist and exacerbate before I'll be like,
Yeah.
you know what, maybe I should, my toe's been hanging off dog,
Right, on
for
the
6
real.
months.
I should probably get that looked
Let me
at.
go get that looked at
But
real
first,
quick.
I'm gonna go to a take care clinic or somewhere else. And no disrespect to
No.
like nurse practitioners and take care clinic, but I feel like I need to go here.
You have to
because
work your way. Well,
I'm
first,
gonna be
no,
seen.
honestly, the first thing is I'm gonna call my mama.
That part, yeah, gotta
That's
call
what we gonna
moms.
do,
Yes.
right? We gonna start there, and then we're gonna escalate. We're gonna go, the group, the circle's gonna get wider, right? Like I'm gonna
Yeah.
cast out a little bit of, then it's gonna go to medical professional friends. Like, okay, there's
Yeah.
tons of nurse sorors in the chapter. Hey, group chat, what y'all know about, what I'm
Right.
saying?
What's this
And
about?
then it's just like you just kind of slowly expand. So we literally take levels to this.
Yeah.
It does. It does.
To avoid that
Oh,
experience.
absolutely.
And it's literally just that, the
Mhm.
experience of
Yeah.
not being heard, not being listened
From a doctor
to.
that comes to talk to you for 2 seconds.
Yes.
Like I hate that.
And that's exactly what, see, y'all triggered me.
Listen, I hate it. Like they literally, like I don't even want to talk to you. I've been talking to this nurse. Like I just want to chill with her. I want the nurse. I don't even want to talk to you.
Yeah, oftentimes I'll go, to my doctor's appointments. I never tell them what I do. I never tell them I'm in the medical field or
That is
anything because I
funny.
want to get a raw experience of how
Yeah.
are you really gonna treat me.
Mhm.
And it's totally different. I always see the difference of, I
Mm.
may have seen that one time. I might come back and then I'll tell them it's a totally different
Oh
experience.
yeah.
Mm.
They're talking to me, that now you got questions and want to know all this stuff
Mhm.
about me. But before you just came in, what was wrong with you? Okay, I'm out.
Yeah.
And
You should
it's-
take like a
it's
hidden
different.
camera. We have to expose them. Oh, ABC.
Oh, it happens. I will
Oh
cut a
my
doctor off in a minute. Like if
gosh.
I come in and you already giving me that vibe of like you don't care, I won't ever see you again. Never
Yeah.
again.
Yeah.
And a lot of people don't know, like you have options. Like,
Yeah.
you don't have to stay with somebody who's not listening to
But
you.
we're used to abusive behavior.
Oh,
So, you know,
absolutely.
we just
Yeah,
continue.
you think it's normal.
We be
We
like,
think it's that's the
exactly.
norm.
Well,
Yeah.
it's normalized.
Yeah.
So,
This is
oh
what
my
I'm here for.
God.
Listen, I'm gonna need your card because I was promised I'm changing
know.
doctors today.
Today.
Like, I will come to you. I don't ever want to go to that place again.
Look, she gonna be like, get out of my office. Okay. Yeah.
Just show up like,
Because
hey.
we're gonna be there with the hypothetical question.
Yeah.
Like, now that we know we got options, we're gonna be like, so
Oh,
let's just say that I
no.
did have a baby. So, are you pregnant? No.
No.
Are you thinking about being pregnant?
Why are we even talking
No.
about
No.
Like, why are we? This don't even matter. But let's just say hypothetically.
Listen, I'm running through everything.
Right. You're gonna be like, I actually have faith. I'm like, oh, just bring him in. It's cool. It's
Right.
cool.
Listen.
No, but man, no, this has been an amazing discussion.
Amazing, yeah.
Thank you for coming. We have to do our to-go box.
Yes, we do.
So
We do.
I'm gonna start with you, Bestie. What are we taking home? What are we gonna take away from this discussion?
Wow, this was a really great discussion. And I wish, I would have met you years ago when I was going through my pregnancy, because I don't think I had no more kids, because I'm truly traumatized and scarred. I'm out on that. But this has been great. I think this is a topic that we need to have. A lot of Black people, Black women in general, we don't know what we don't know. So having conversations like this opens the door to really questioning it. Like, this isn't appropriate practice. You are treating me different. This is racism. These are microaggressions. So I think having this conversation was beautiful. I've learned so much by talking to you. I'm serious about switching. So I will get that contact information from you. Because I think, we shouldn't be discriminated against in health. Like, this is life or death, and this is crazy. So I'm just soaking it all in, and I'm glad we're getting this out. So hopefully people take to this episode. It was really great.
Yeah, absolutely. What are you taking away?
I would say that I'm just, taking away that, I'm really grateful to have the opportunity to even talk about this. So one, I want to thank you
Right.
both for bringing me here. But just also understanding that, this is the beginning. We haven't even scratched the surface of how deep this stuff goes. And so, this is what pushes me to continue to keep putting this out there. And I'm just going to keep on, posting what I post and saying what I say and
Doing what I
doing what I do.
All that.
So yeah, that's my takeaway.
Awesome. And you, what you taking away?
Oh, wow. So first, I do want to thank you for coming.
Yes.
And I want to thank you for, in your everyday, just being an advocate for us. Because, with you working with your organization and being the face of it and making sure that, you're hosting these sessions and going above and beyond. I'm sure that that's outside of the scope of your work, right? Because I haven't seen other people doing this. So I thought that was really amazing. That's really why we wanted you to come, because I'm like, oh, like you're very passionate about this. It seems to be very purpose driven.
Yeah.
So I'm grateful that we have people like you in the industry that are intentional about doing this for us, because again, we don't know what we don't know. And even with you saying like how I can change my business, I was like, first of all, who knew that I had the option?
Listen.
So that's great. But so what I'm taking away is that we need to be informed, that unfortunately we cannot rely on people to inform us or on the medical professionals to inform us. So we do have to listen to podcasts like this. We do have to kind of go out of our way so that we can appropriately advocate for ourselves, because if not, we're just going to settle. And y'all know how I feel about settling, child. Even in healthcare.
Listen, no settling. Nowhere. No settling ever.
So thanks for tuning in to Brunch with Besties podcast. Until next time.
Peace.